All right, today we're looking at something fascinating, an artifact that could seriously change how we learn about our own health. We're talking about a story, and it might just be more powerful than any medical pamphlet you've ever seen. Let's find out why. Okay, so let's start with a question I think we've all faced at some point. You get a diagnosis or a prescription, and what happens? You're handed this leaflet, right? It's crammed with tiny print and words you definitely can't pronounce. It's supposed to be helpful, but a lot of the time, it just adds to the stress. Sound familiar? This really gets to the heart of the whole problem, right? On one side, you have the typical health advice. It's jargon heavy, it's clinical, it's totally impersonal. But what if there was another way? A new approach that was story-driven, relatable, and actually engaging. I mean, can we really make that leap? So what would a new kind of prescription even look like? And I don't mean for medicine. I mean a prescription for understanding. It's all about moving beyond that standard pamphlet and into something way, way more effective. Well, a company called Acepharm looked at this exact problem and decided to try something completely different. I mean, they really wanted to break the mold. So instead of making just another clinical document, they created an artifact, a unique piece of media that was designed to educate in a totally new way. So this unique approach led them to create this fascinating artifact. And to really get it, we need to meet Alex's gatekeeper, because this whole idea really starts with its very, very unusual title. And here it is. It's not called, a guide to managing hypertension or understanding Lisinopril. No, it's Alex and the Blood Pressure Gatekeeper. I mean, it sounds less like a medical handout and more like a fantasy novel, doesn't it? And that is absolutely the point. Every single word in this title is doing some really important work. Think about it. Instead of a patient, we have Alex, a protagonist we can relate to, someone on a health journey. Instead of a complex bodily function, we have the blood pressure gatekeeper, a creative metaphor, a character. And lisinopril, the actual medicine, becomes a part of the adventure. This simple reframing it's brilliant. It instantly makes a clinical topic feel human and accessible. So this whole narrative approach, you could almost call it the storytelling treatment. But okay, beyond just a clever title, how exactly does telling a story heal confusion? How does it actually work? Well, the source material itself defines this as a Pixar-style educational storybook. So what does that mean? It means using the same tools that master storytellers use. We're talking about compelling narratives, relatable characters you actually root for, and a genuine emotional connection. Because think about it, when you feel something, you remember it. You don't just process the information, you internalize it. But of course, with this kind of creative power comes great responsibility. And that brings us to a very important footnote in this story. The critical line where education ends and medical advice begins. And the authors at Acepharm are really upfront about this. Right from the get-go, they say, this story is here to help you learn about the body and medicine in a fun way. The intent is purely educational. It's designed to demystify a complex topic and make the whole process enjoyable instead of intimidating. And then comes what is maybe the most important line in the entire book, a very clear boundary. But remember, it's not medical advice. This is so crucial. It's designed as a tool for understanding, not a prescription for treatment. So, how are you actually supposed to use this tool? Well, the path is pretty clear. Step 1, learn with the story in a fun way. Step 2, remember, it's an educational tool, not an actual prescription. And step 3, the most important part, always ask a professional guide. That's your doctor or pharmacist. Use this new knowledge to have a better conversation with them. Ultimately, what this artifact really represents is a potential shift in patient education. We're talking about empowering people through understanding, not just giving them instructions. Because when people truly understand what's happening in their bodies, they stop being passive patients and become active partners in their own health. And that leaves us with a final thought. In a world just saturated with complex data and clinical jargon, could it be that a story, our oldest form of communication, is actually the most effective medicine for confusion?